Those causal explanations that are sort of deep and understandable to the audience are too rarely provided. So I mentioned sort of my awakening to this was 20 years ago in public health school, but what we've been doing is we monitor the media environment. So we do these analyses we call content analyses of news media coverage of particular health and social issues, and we try to count. Right, we count the number of times, say, a racial disparity is mentioned in a news
Mm,
story, and then we count the number of times an explanation is provided for that difference. And in one study that we published a few years ago, where we were looking at news coverage of the beginning of the COVID pandemic, we found like over 100 television news clips that talked about emergent racial disparities in COVID incidence, prevalence, and mortality in the early phase of the pandemic. And two-thirds of them never gave an explanation for why that was.